Nowadays, you'll hear about 6-session therapies or 10 or 12-session therapies, or the less specific short-term therapy, which can be anything from a few sessions to 20 or more. Why sign on for long-term, open-ended therapy when these shorter options exist? Because shorter treatments have a different aim. It all depends on what you seek from therapy. Fewer sessions are not necessarily better. In this 5th video in my series on myths about psychotherapy, I'll set the record straight. I'm Dr. Stephen Reidbord, and this is More Than Meds, where I talk about psychotherapy and psychologically informed psychiatry. Stay tuned. Back in the olden days, not that old, the 20th century, psychotherapy was open-ended. It had no set number of sessions. It wasn't clear how long it would take. It could go on for months or years. Patients often arrived with specific complaints, things they wanted to work on, but the discussion would range far and wide, eventually exploring the nature of all their interpersonal relationships, what they do with their time during the day, work or whatever, and many other areas. The initial reason for coming in often expanded to all different facets of the person's life. The point was that all these areas are connected. They're all about you, your personality, that you take from situation to situation. A big part of psychotherapy is pattern recognition, noticing one kind of dynamic in a certain setting, and then noticing that it occurs in other settings as well. If you think about it, this isn't mysterious. You have a personality and you take it from situation to situation, from relationship to relationship. It only stands to reason that if a certain kind of dynamic comes up in one setting, it'll come up in other settings as well. By a process that we psychotherapists call working through, by honestly reflecting on the feelings and reactions that come up in different situations in one's life, we learn together what makes you tick, what's going on underneath in your feelings, what pushes your emotional buttons, what are the underlying roots of the problem. And because the interaction with the therapist is a real-life, live example of an interpersonal relationship, we get to see in the therapy office or on Zoom, however you're doing psychotherapy, a real-life example of interpersonal relationship taking place. We have a natural experiment to observe right in the room. This is the value of open-ended psychotherapy. We don't really know where it's going to lead. We don't know what will be uncovered. In that sense, it's creative. New things might come up that are unanticipated. We may end up in unexpected places, make connections that we didn't think we'd make, and come up with solutions or resolutions of problems that were completely unexpected. It takes as long as it takes, and that isn't known in advance. By the way, open-ended doesn't necessarily mean long. Sometimes a person gets what they came for in relatively short order, and as I was discussing in a previous video, it's not the purpose of a therapist to make you a lifelong patient or client. We want to make ourselves obsolete in your life. But contrast that model with brief, time-limited therapy. Because it's brief, there's no time to let the inquiry roam far and wide. By necessity, it needs to be very focused on the presenting complaint, the specific reason the person came in. For that reason, it's much better suited for concrete or easily defined or unidimensional, one-dimensional types of problems. I'm feeling depressed and I want to feel less depressed. I'm feeling anxious and I want to feel less anxious. Or I have a specific interpersonal conflict I want to try to understand and resolve. Or a specific career question I want to resolve. Short-term therapy can be very helpful for problems like that, where there's no serious effort to look for patterns across the person's whole life. When I said back in the olden days, I was sort of kidding. Open-ended psychotherapy is alive and well. In fact, it's a major part of my own practice. But our culture really pushes for the short-term kind. For that reason, it's easy to assume that shorter is better, that it's more efficient, that it doesn't waste time and money, gets to the point faster, that it's more modern, and so forth. We can solve your pain in 3 sessions. That's a myth. Look, a lot of people don't want to open Pandora's box. They like that short-term psychotherapy is narrow and carefully focused and won't just roam far and wide. For one reason, they're afraid of where it might lead. There's a fear that once you open the floodgates, who knows what might come out. The client might learn things about themselves they didn't want to learn, for example. And another reason is fear of dependency. Like I said, a lot of clients or patients have some concerns that they'll just get too used to therapy, that they'll get too reliant on it, that it'll just be too comfortable, perhaps. These are all areas that we therapists are sensitive to and really don't want to encourage, but that can lead people to prefer short-term treatment to save themselves that worry. Some of it, too, of course, is practical concerns about time and money. Those are all legitimate concerns. But let's not fool ourselves. If the problem you're dealing with is woven throughout your life, if it's vague and ill-defined and hard to put your finger on, if your problems stem from early trauma or a dysfunctional childhood, it's no bargain to sign up for a 10-session therapy. You'll barely scratch the surface about what's really going on. Unfortunately, third-party payers like insurance companies much prefer short-term treatment for obvious reasons. It costs less. Patch up the immediate problem and be on your way. Short-term treatments are also easier and less expensive to conduct research on. Imagine how much easier it is to study a treatment that only lasts a few weeks versus one that goes on for months. As a result, there are a lot of research studies that show that short-term treatment help for very specific needs. The thing is, people often seek psychotherapy for other kinds of reasons. None of their relationships are satisfying, or they've had a whole series of failed romantic relationships. They're getting in their own way. They're not fulfilling their potential. They're thwarting their own happiness or success. The truth is, nothing has replaced open-ended psychotherapy for these kinds of problems. Not medications, not short-term therapy. Getting to the root of fundamental emotional roadblocks takes insight, not just intellectual insight, but emotional insight. And it requires a therapeutic relationship, a relationship between the patient or client and the therapist that's both diagnostic, because it's a real-life relationship and we can see the dynamics that emerge, and also therapeutic, because that relationship is healing in itself. Well, that's it for today. Please like this video if, in fact, you like it. Please subscribe if you have not yet. And as I mentioned, this is a part of a series that I'm doing on myths about psychotherapy. And this is the playlist where you can see the other videos that I've done and that I will do on this general topic. Thanks for your attention. See you next time. Bye.